It is the season. If you're dealing with sinus issues, snoring, or even nasal congestion, many people assume the answer is a quick procedure, but that's not always the case. So today, we're joined by Dr. Tobin from Ohio ENT and Allergy Physicians to talk about why a proper diagnosis is the key to the right treatment. Because in ENT care, one size does not fit all. Evan, it's so nice to meet you today.
Nice to see you. Yeah, nice to see you.
So let's start with the basics. What is ENT exactly? What does that deal with, and what types of diagnosis are you dealing with?
So ENT, otolaryngology, is a surgical subspecialty, and we deal in diagnosis and management of ear, nose, and throat problems all the way from babies to centenarians, so 100-year-old people. It can range from hearing problems to ear infections, sinus infections, throat infections, and even serious things like lumps and bumps and malignancies in the head and neck area.
And I'm sure when people get symptoms, the first thing they're doing is Googling them online to try and figure out what it is. But why is it so important to see a specialist and get that diagnosis on your first visit?
First of all, people learn a lot online, and we get that, and encourage it even, but there's misinformation out there. And what we don't want is delays in diagnosis. We want proper diagnosis, and we don't want people to think that maybe there's a quick fix to something, and they see an ad on TV and they can get a procedure and get fixed. The important thing is to come in, explain your symptoms, what's bothering you, what have you tried, what has your family medicine doctor tried, and then have an ENT doctor make a proper diagnosis and start treatment. And in spite of what people think, we're not always looking for a procedure to do on people.
Oh, that's a good point.
Yeah, most people are going to respond to medicine, and it's finding the right medicine.
And when people have that diagnosis, maybe they do need that procedure. Is it some cases where that can just be done in the office? How does that work?
There are procedures that can be done in the office. First of all, we have diagnostic procedures that we do in the office.
Okay.
And some of these sound scary. We use little tiny endoscopes to look in the nose.
That tickles me the last time I had it.
Yeah,
a little tickle.
I remember we talked about this, yeah. And so we can do very simple, painless diagnostic procedures in the office. We can do imaging in the office. And there are procedures that we can do in the office to take away swelling in the nasal passages and help people to breathe better. There's cosmetic procedures that can be done to help people in the office. But there is also the need sometimes for more invasive things and more involved things. And again, it comes down to evaluating the patient, making the proper diagnosis, and not trying something that sounds easy that is not going to work, and getting to the the fastest correct diagnosis and treatment that you can.
That is so good. And right now, this season that we're in, a lot of things, you have sinuses, you got weather changes. What are some of the most common things you're seeing that you guys are able to diagnose and treat?
So we're getting out of swimmer's ear problems in kids, and we're going to move into middle ear infections.
Okay.
And so, kids are back to school, colds are starting, and that leads to middle ear infections in babies and in older kids who are in grade school. And then we're getting out of kind of the peak allergy time, and we're going to start to get into upper respiratory tract infections, which leads to sinus infections.
Yeah.
And this is where a patient who might have maybe an underlying deviated septum, and we were talking about that. So the inside of the nose has a dividing structure, and if you've got a deviation of that septum, you do okay until you get a cold, and then you get a cold and your nose just blocks up, and you reach for things over the counter, and you're maybe getting frustrated, and that's where we can help.
And this is the sign for people watching. Like you said, you want to get in sooner rather than later. So how do they book an appointment, and where can they go to find out more information?
Well, first of all, you don't need a referral. Your family doctor may make a referral, and that's fine, but we don't expect people to get that referral. You can call and schedule an appointment.
Your team knows what's best from the child
to
the adult. You see what I did there?
Yes, I see
Dr. Tobin, thank you so much for sharing this information.
Again,
don't put it off. Reach out to the team at Ohio ENT and Allergy today. The website is right there on your screen, ohioentandallergy.com. We'll be right back.